It's December 2013. A 2-year-old boy in the Gikido region of Guinea has fallen ill with a severe fever and dies within days. We learned that he had Ebola, a nasty virus with a high mortality rate, which is transmitted person to person through contact with infected bodily fluids.
Though this is the first case ever reported in Western Africa, Ebola is not new. In fact, it has been present in Africa since 1976.
It's now late March 2014. Guinea's Ministry of Health just provided formal notification to WHO of an Ebola outbreak, which has now reached 50 cases and claimed 30 lives. And these cases are not contained to the Gikido region. They have spread mostly to rural areas. However, 3 suspect cases are being investigated in Conakry, Guinea's capital and largest city.
Guinea's Ministry of Health has activated the National and District Emergency Management Committees to coordinate response, and has now advised the public to take measures to avert the spread of the disease and to report any suspected cases. WHO reports that they and other partners are mobilizing and deploying additional experts to provide support to the ministry. Médecins Sans Frontières, or Doctors Without Borders, is taking the lead in affected areas by assisting with establishment of isolation facilities.
It's now May 19, 2014. Crediting the WHO for rapid deployment of staff and equipment, Guinea's Minister of Health reported that field investigations were yielding very encouraging results when he briefed the World Health Assembly. Unfortunately, nothing can be further from the truth. This graph shows the cumulative number of Ebola cases in Guinea from the beginning of the outbreak through November 2015, and the red arrow marks the date of the Minister of Health's statement.
It's now later in May, and Ebola has been confirmed in Sierra Leone. Now June, and Ebola is in Liberia. Before this, most of the cases had been in rural areas, but unfortunately, the virus now enters West Point in Monrovia, Liberia. West Point is West Africa's largest and most notorious slum. More than 70,000 people crowded together on a peninsula, with no running water, sanitation, or garbage collection. The number of Ebola deaths in that slum will likely never be known, as bodies have simply been thrown into the 2 nearby rivers.
It's now July 20th, and the virus has spread to a new country, Nigeria, via a symptomatic air traveler. This is a potential nightmare. Nigeria has the largest population of any country in Africa, and the air traveler flew into Lagos, which has a population of 21 million, almost as much as Guinea, Sierra Leone, and Liberia combined. But immediately after this first case is confirmed, the Nigerian government declares a national public health emergency. The Nigerian Ministry of Health forms its Ebola Emergency Operations Center, and doctors are trained to treat Ebola patients. Local health workers pay 18,500 face-to-face visits and take approximately 900 temperatures of people who could have had contact with Ebola patients. Nigeria escapes this potential catastrophe with only 20 cases and 8 deaths, while also keeping its borders open to Guinea, Liberia, and Sierra Leone.
It's now August 8th, more than 8 months after the index case, and the WHO officially declares the Ebola outbreak a public health emergency of international concern. There are currently 1,711 Ebola cases, causing 932 deaths in multiple countries.
It's now September 18th, and the United Nations Security Council just called on member states to respond urgently to the crisis and to refrain from isolating the affected countries. An emergency health mission called the United Nations Mission for Ebola Emergency Response, or UNMIR, is established at the meeting. UNMIR is designed to stop the outbreak, treat the infected, ensure essential services, preserve stability, and prevent further outbreaks. To be effective, UN Secretary Ban Ki-moon estimates that the current Ebola response must be scaled up some 20 times from current efforts. Approximately 130 countries co-sponsor this resolution, helping to turn the tides on Ebola once and for all, nearly 10 months after the index case.
The financial, developmental, and human loss from this Ebola outbreak was devastating. Response efforts cost billions of dollars and continue to plague the economically strained African nations. With nearly 30,000 cases, more than 11,000 people in Guinea, Liberia, and Sierra Leone lost their lives, and survivors continue to face stigma within their communities.
Moving forward, we must carefully scrutinize these devastating events and learn from what happened. First and foremost, who's to blame? Secondly, why were some countries, such as Nigeria, able to contain the disease so quickly, whereas others faced catastrophic loss from this infectious disease? And third, what steps must the international community take in order to prevent this from happening again?